Okay, so very good evening, everyone. So on behalf of DentistChannel.Online, today I would like to extend a very warm welcome to all of you present here. I am Dr. Richa Elawat, and I would be the host of today's session, Comparison between Intraoral Scanners and Conventional Impression Techniques by Dr. Hilary Mori. So before starting this session, I would like to inform everyone that if you have any questions or any doubts during the session, you're requested to put your questions in the Q&A section, not in the chat box, in the Q&A section, and we'll be taking up each and every question after the session. So without further ado, I'll firstly like to introduce our speaker, Dr. Hilary Mori. Hello, doctor.
Hi, Richa. Thank you so much for giving me this opportunity.
Yeah. So firstly, I'd like to introduce her. She's currently pursuing her master's in prosthetic dentistry, Crown and Bridge from Bharati Vidyapeeth, Pune. And also she's the creator of Dento Woman, which is a YouTube channel. Her goals through Dento Woman is to create content that is full of passion for dentistry and to provide expertise and experience with her budding dentists. And now she has completed her graduation from Rajasthan University of Dental Sciences. And if we talk about her achievements, she has won the Student of Year Award at FAMDent India in 2022. Also, she has won the Gold Prize at Dentoscope Paper Presentation FMR Week, and also the Silver Prize at Dentoscope Scientific Paper Presentation Implant Materials and Advancement. It's a pleasure to have you with us today, Doctor. So we thank you for taking out your time from your busy schedule and being with us today.
Thank you so much, Richa, for warm welcome, and I hope that this session remains informative and full of knowledge for our viewers.
Yeah, correct. So now we can start with the webinar, doctor, and now it's over to you.
Yeah. Dr. Richa, could you please share my screen? That PPT. Good evening, everyone. So as you all know that today's lecture is on current perspective on digital intraoral scanner versus conventional impression techniques. So now is not the time where, you spend so much time making the impression, correcting your impression, then you send it to lab makes a model out of it and then makes a crown or maybe a bridge or and implant prosthesis over it. Okay, so now the time has changed. Now dentistry is getting really evolving really fast each and every day, especially in the field of digital dentistry. So whether you are an undergraduate, postgraduate, or a practicing dentist, I have created this seminar, like, you can get a bit of theory from it and also a practical aspect as well. So at the end, we'll discuss that which intraoral scanner as a clinician you should purchase, okay, and what are the things you should keep in mind while purchasing an intraoral scanner. And before that, we'll discuss a little bit of theory, which is important to understand this concept of intraoral scanner, okay. So the contents will be, will start from introduction, importance of impression making, why impression making is so much important, then advantages, disadvantages of conventional versus digital, and digital versus conventional workflow, and the current popular systems which are available for intraoral scanners, okay. So I would like to take you all into the history where, somewhere in the 18th century, there was the first impression material which was being used. So what earlier dentists used to do is that they used to paint the ridge and then placed an ivory block over the ridge. And that's how they used to make an impression. But now we have come a far way, okay, where now it is nothing, just you will get a wand kind of thing in your hand. You will just use it over the teeth and the periodontal ligamental area of the patient's mouth, and it's done. It's as easy as that, okay. So we have the first doctor who introduced the intraoral scanner was Dr. Werner Morman in 1986, and the first intraoral scanner was CEREC 1. Okay, and it was introduced in Switzerland by none other than Dentsply Sirona. Okay, so now moving ahead, yeah, here is the picture of Dr. Mormon. So what is the impression, what is the importance of impression when it comes to prosthesis? Like in my journey of 2 or 2.5 years into this field of prosthodontics, I've realized that the most important thing for a successful prosthesis, whether it's a complete denture, whether it's a removable partial denture, or it's a fixed partial denture, or it is your implant prosthesis, the most important thing is impression. Agar aapne impression sahi se liya hai, then the prosthesis is going to be perfect. Okay, and making an impression is an art, it is a skill. Okay, you don't get a perfect impression in the first try. Okay, so importance of impression cannot be emphasized more. Okay, it is the most important thing when it comes to a successful prosthesis. Okay, so let's look at the pros and cons of conventional versus digital intraoral scanner. Okay, if we compare these two systems, like you have intraoral scanners available in the market also, you have light body putty available in the market also. Okay, so what you should use in what situation? So when we talk about conventional, the advantages are, first of all, cost effective hai. Okay, and polyvinyl siloxane polyether materials, they have high accuracy when it is used correctly. Okay, so the technique has to be right to make a correct impression. Then it avoids the problem of using intra and extraoral scanners, which we'll see further. Okay, whereas the advantages of digital intraoral scanner is that it eliminates messy impression process. Okay, now we all know that it is so frequent that we get a patient who is a gagger, who is a severe gagger. Okay, and it is very frustrating for us also, especially when we are fighting with a time, like we have a few patients waiting outside and we have to finish a procedure in a time. But if you have a patient who has a severe gag, then it's very difficult to manage such situations. So that's where intraoral scanner comes into play. Okay, then it improves the patient's acceptance also. Okay, when it comes to dentistry, when you're doing something inside patient's mouth, okay, it is a very different experience. No one likes to put someone's hand inside their mouth. Okay, it is a normal human response, I would say. Okay, and this is where I realized when my senior took my alginate impression, and that's when I realized that how unpleasant it is. So as a dentist, all our efforts should be to minimize this experience, to make this experience as pleasant as possible, and that's where intraoral scanners are useful. Okay, it improves the patient's acceptance. Then it is time efficient. It takes hardly 2 to 5 seconds, okay, to scan a single arch or to that particular quadrant. Okay, then three-dimensional pre-visualization of the preparation you can do. Okay, then there is a prosthesis delivery time get shortened as the laboratory steps are decreased when it comes to digital intraoral scanners, and better communication with patient and lab technicians can be done through intraoral scanners. Okay, but now there are disadvantages of this as well. Okay, so first of all, purchasing and managing is a big cost. Like intraoral scanner can be a huge investment for your clinic. Okay, so also there is this wand. Okay, so maybe for pediatric patient it is difficult, although now they have various modifications in intraoral scanners also. You get a different wand size for pedo adult patient differently. Okay, but yeah, it could be one reason. Then there could be medical legal complications. Okay, then there is a learning curve. Whenever you are learning something new, definitely there is a learning curve associated with intraoral scanners. Okay, and necessity for gingival tissue retraction to visualize the preparation margin when it is deep. Okay, so when you have a deeper margin, your light body can flow ekdam aaram se and it can record a very accurate, nice impression. But when it comes to intraoral scanner, it cannot. Like scanner जो चीज देख नहीं सकता है वो record नहीं कर सकता है. Okay, so if you want to record subgingival margins, then you need to do the perfect retraction. You need to retract the gingival tissue. The scanners should be in a good approximation with your margins, and then you can scan it. Okay, and then patient mobility can create some artifact while scanning. Okay, and with the conventional, we all know that what are the difficulties with conventional impressions, like, right? That first of all, tray selection galat ho gaya, to impression galat aayega, right? Then impression material ka flow or uski hydrophilicity, it is also a very critical factor when it comes to conventional impressions. Then working time, okay, you have to make impression in 3 minutes and 4 minutes. In that time, material sets, and you have to take a perfect impression, so you have a short working time in here. Okay, then patient movement again, then tearing or deformation of the impression while removing, especially with the alginate. Okay, and these conventional impressions require disinfection, which was a huge issue when we were in COVID era. Okay, so in such situation, digital intraoral scanners are quite acceptable alternative to our conventional impressions. Now we'll look at the workflow which is associated with digital as well as conventional impressions. Okay, so moving ahead, in the conventional, you all know that first thing is you have to do the tray selection, right? Here I have put a small video for you guys. Okay, this is how we make alginate impression, starting with the tray selection and loading the material correctly. Okay, and making the impression correctly, followed by disinfection. Okay, and when you are fabricating a crown, then again you need to pour it. There is a model which you get, then you do the die preparation and so on. Whereas workflow for digital impression making is quite simple. Okay, there are very less steps, as you can see. First you will do the scanning. Okay, then you will review your scan. Okay, that whether you have recorded all the teeth and the gingival aspect of all the teeth correctly or not. Okay, and then you will share this information with your lab. Okay, and then lab will design a crown by using a software. Exocad is the most commonly used software. Okay, so they'll do the computer aided designing and milling. Okay, and then they'll also do the 3D printing of a model, and your restoration is ready, just the characterization followed by delivery. So the workflow for digital impression is quite simple. Now there's intraoral scanning. How does it occur? What is the technology or the science behind this intraoral scanning? Okay, so there are 4 currently used imaging technology with intraoral scanners. Okay, triangulation is the one, that it is based on a principle that the position of the object can be calculated knowing the positions and angles of 2 point of views. Okay, and these 2 point of views may be produced by 2 detectors. So this is what something is there in the aperture of intraoral scanner, which is facing towards your tooth. Okay, then the another is a parallel cone focal imaging. Itero is the intraoral scanner company. Okay, Itero, and it uses this parallel cone focal imaging technology. The parallel cone focal technology allows the data capture wand to rest directly on the tooth surface, which helps steady and it also lighten the wand. Okay, जो ये wand you are using, no, uska weight काफी कम हो जाता है because of parallel cone focal imaging. Okay, and it should not contact the soft tissues, and patient does not need to open mouth wide. So that these are the advantages with parallel cone focal imaging or Itero intraoral scanners. Then another one is accordion fringe interferometry. So there is no powder coating is required for scanning. So this was earlier days where you want to scan something, you will place a powder. Okay, it's a titanium dioxide powder, and which you spread it over the teeth and the gum tissue, and then you will scan. Then and then your scanner can scan it. But now no more this technology is there. Powder is not required. Okay, as we have advanced into the technology of intraoral scanners. The other is three-dimensional in-motion video, which is there in Lava COS and 3M ESP true definition scanners. Okay, and the scanned images can be captured quickly and highly virtual on screen model can be created instantaneously. Okay, and drying of the arch and powdering is required to locate the reference point for scanners. So these were the four main technologies, okay, which are associated. And here I'll show you that scanning path which you should follow, okay, while doing the intraoral scanning. So studies have shown that scan path has a huge impact on the accuracy of your impression. Okay, it's fine. It is very simple for you now that सिर्फ आपको एक wand दिया है and you have to move your hand over the teeth and the region which you want to record. Okay, but still there is a method, there is a technique which you should follow to get a correct impression, and it has a good impact. It has a huge impact on the accuracy of the impression. So the scanned object, it should be positioned at the center of the acquisition area to describe an optimal sphere around the object. So let's say that I want to record this point, this particular point, and this is my intraoral scanner. Okay, so this point should be right in the center of my intraoral scanner, and that's when I can record it completely. Okay, and the camera, which the intraoral camera, it should be held 5 to 30 millimeters of the scanned surface, depending on the scanners and the technologies. That is different for different scanners, but it ranges from 5 to 30 millimeter of distance hona chahiye from the surface which you want to scan and your intraoral scanner. Okay, and then there are some specific manufacturers guidelines which you need to follow. Now, moving ahead, we'll discuss about the current popular systems which are available. And this particular slides I have created from a review of intraoral scanners at IDS 2019. Okay. So first we'll discuss about 3Shape, which is Trios 4 is the model name by 3Shape company. Okay, so this intraoral scanner is one of the fastest scanner in the market, and full arch scan. Okay, पूरा mandibular arch का impression आप 25 seconds में ले सकते हो. ठीक है, 25 seconds, 25 seconds. So 50 seconds, in a minute, पूरा impression खत्म आपका. Full mouth impression is over in less than a minute. So that is the speed of this intraoral scanner, and it also detects the surface caries. Okay, and it has smart tips. So it keeps a track of how many times they have been autoclaved. So the tip that needs to be autoclaved, but it is a smart tip here. So it counts on its own कि हाँ आपने कितनी बार autoclave किया है, and the software works well for the most part, but is still having some issues with stability, causing the occasional crash or file corruption. Okay, so the stability, you need to keep it very stable. Also, the patient has to be stable for this. Okay, now the next intraoral scanner is Dentsply Sirona is the company, and the model name is Serec Prime Scan. Okay, it is also a very fast scanning speed, but if you'll see that the shape of the scanner is different than what we saw of Trios 4. Okay, so most fluid, and it is a lag free scanning. Okay, and scanning depth up to 20 millimeters it can scan. Okay, so the scanner is one of the heaviest in the market. Okay, it is very heavier to hold, and the workflow is similar to the Omnicom, and it works well. Omnicom will study later. So the another scanner is Medit by the company Medit, and the model name is i500. Okay, it is impressively fast and smooth, and it is the lightest scanner, also most affordable. So most of the dentists in India are having Medit. Okay, That's what I have seen, at least here in Pune. And it allows exporting the STL, OBJ, PYL formats. Okay, so these are the different formats. Like एक अपना image होता है, उसको हम JPEG में भी save कर सकते हैं, PNG में भी save कर सकते हैं, right? So similarly, when you scan, no, you can save it into different file formats like STL, OBJ, PYL. So ये सारे files को it supports. And there is no associated design software. It is purely a scanner with the software, which is allowing control over the scan and an impression lineup of the evaluation tool. Now, moving ahead, Align iTero. It is by the company Align iTero Element 5D. Okay, it is relatively larger, as you can see in the image, and it is one of the heaviest, but it does the caries detection and it has a touch screen with it. So these are the advantages. Now, what you should actually look for before buying an intraoral scan. Okay. Kindly change the slide. Yes. So now what you should look for before buying an intraoral scanner. Okay. So there are some properties which you should look for. First is the trueness of intraoral scanner, precision, resolution कितना है उसका, okay, need for opacization and scanning speed, उसका tip कैसा है, okay, whether it is small or large, or also that in color images है कि नहीं है, and the system, which files it is supporting. So these are the things which you should see before buying an intraoral scanner. So trueness, precision, and resolution should be high, okay, in whatsoever scanner it is. And scanning speed, obviously it should be fast, and tip should be small as well as thin, okay. And the better it supports the different kind of files, it is better for you to communicate with different laboratories. Now we'll look at the clinical impact of intraoral scanners, okay, that are optical impressions or the digital impressions, they are as accurate as conventional impressions. So there are so many studies which have been done over a period of time, which have compared the different aspects, the precision, the trueness of intraoral scanner versus the conventional impression techniques, okay. So a scanner should be able to detect an accurate impression, okay. So the trueness and the precision mainly depends on the scanner acquisition or the processing software, which performs the most difficult task, building a 3D virtual models, okay. And also it depends on the sensitivity of the instrument. So these are the factors, as I discussed in the earlier slides, you should look for if you want to achieve an accurate impression with digital intraoral scanners, okay. And to date, the scientific literature considers the accuracy of digital impression clinically satisfactory and similar to that of conventional impressions in case of single tooth preparations and fixed partial prosthesis up to 4 to 5 elements, okay. So single crown or 4 to 5 elements where accuracy is almost similar with your conventional and your digital impression. But when it comes to full mouth cases, okay, full mouth implant cases, then in such scenarios, digital intraoral scanners are have shown that better accuracy and trueness compared to conventional impression techniques. Now, moving ahead, where these intraoral scanners are indicated, like it helps you in what situations. So intraoral scanner has extremely wide applications, okay, in prosthodontics, whether you are doing inlays, onlays, or you are doing zirconia crowns, you are doing single tooth preparation for Emax restorations, okay, that is your lithium disilicate. Then the frameworks and fixed partial dentures and zirconia for single implant cases, for implant supported bridges, okay, for implant supported bars, as in your implant supported overdenture cases, okay, in post-end cores, in partial removable dentures, in digital smile designing, and in obturators in case of maxillofacial defects. In all these cases, intraoral scanners can be used. It can scan your preparation, okay, And in implantology also, the guided implant surgery is very much possible with digital dentistry. Also, intraoral scanners are used in orthodontics, okay, for the diagnosis and treatment planning, for aligners, for custom made devices, and as a virtual patient. Like in ortho, it has a huge role when it comes to digital dentistry. Like it eases your treatment planning and your diagnosis part very well. Now, where you should not use intraoral scanners, okay, there are very few contraindications, but yeah, there are contraindications. So long span fixed partial dentures and or fixed full arches up to 6 to 8 elements, it is relatively contraindicated. It's not absolutely contraindicated, okay. But with the latest intraoral scanners and the digital labs like Illusion in Function, we are quite capable of making full arch impressions digitally and a prosthesis digitally, which are fitting quite well. But this is what theoretical data, which obviously you should keep in mind, and it is important for me to discuss as we are discussing about intraoral scanners, okay. And also for the complete removable prosthesis, okay, like your complete dentures, it is very difficult. इंट्राओरल स्कैनर से आपको क्या रिटेंशन स्टेबिलिटी सपोर्ट, इस पे ही कंप्लीट डेंचर इज डिपेंडेंट, राइट. सो विद इंट्राओरल स्कैनर आप वो चीज नहीं कर सकते हो. यू कैन नॉट अचीव दैट राइट अमाउंट ऑफ posterior palatal seal with your intraoral scanners, and that's where this intraoral scanners are lagging behind just in that particular arena of complete dentures, okay. And that is the only area where still conventional impression dominates. That is the area where still your green stick and this zinc oxide eugenol impressions are the best. They are beating intraoral scanners, but still right now many studies are ongoing, and let's see that what future is holding for us, okay. Now, what does the latest research says on intraoral scanner, okay. So the accuracy of intraoral scanner was influenced by operator experience, type of the intraoral scanner, and the scan size, okay. So it is accurate, okay, but it depends ki how you are using it, which kind of intraoral scanner you are using it, and आपके scan का size कितना है, उस पे उसका accuracy is dependent. Then more experienced operators and a smaller scan size contribute to more accurate and faster scans. Okay, and the Trios 3 was more accurate than CEREC Omnicam for complete arch scan. If you ask me about which company or which model is more accurate, then Trios 3 was definitely accurate as per. I've also quoted this research article at the bottom. Okay, so according to them, Trios 3 was more accurate than CEREC. So I hope that we have discussed quite a lot about intraoral scanners, and you all must have got a gist of what are intraoral scanners, how does it work, the workflow, where to use it, where you cannot use it, okay. And definitely, guys, the future of dentistry is digital. The way things are evolving every day, it is definitely digital, and it is very important for you guys to know this topic, okay, and also to practice this topic. Like, I hope that someday we all can have intraoral scanners in our operatory, and we can make this dental experience more richful for all of our patients. Now I would like to share my references. And once again, I would like to thank DentistChannel.Online for considering me and allowing me to share my knowledge on this topic. Thank you so much. And thank you so much, guys, for listening.
Thank you so much, Dr. Hillary. It was a very nice presentation.
Thank you so much.
So before we go to the Q&A session, I would just like to introduce Dentist Channel Online to everyone. Till the time I'm introducing the channel, anyone who has any questions can put your doubts or questions in the Q&A section. So coming to Dentist Channel Online, it is the first digital dental media channel with the motto of healthy smiles and wealthy lives. So our services extend to dental professional and dental students, in which we cater all their academic and professional needs, and also to various dental organizations and various dental companies. The key highlights are like we have till now completed 700 plus live dental webinars, 25 plus dental workshop with almost 400 plus national and international speakers. And till now we have issued 40,000 plus certificate of participation, which are for all the prime members of Dental Channel Online. Also, we have made 300 plus oral care videos under the mission Save the Tooth. So we have also entered the India Book of Records for having maximum number of speakers participating in virtual conference in oral implantology. If you become the prime member, all the benefits you get are firstly a personalized account in Dentist Channel Online. You get regular updates and news regarding to dentistry. You get access to all the webinars and all the scientific presentation, all the articles there in Dentist Channel Online. You get to participate as a speaker. You get to publish various public awareness videos, and also you get a certification for all the webinars that you attend. So this is how the certificate of participation looks like for all the members. So you can be a prime member of Dentist Channel Online and you can get all the benefits, and also you can get the e-certificate with one FDA Germany CPD point. So the prime membership comes at a cost of just $7.99. And if you use the promo code AP100, you'll get a certified discount on the prime membership. These are some of the upcoming webinars in which you can look into, you can participate. So this one is tomorrow, 13th August, treating primary incisors. Let's add shine to those tiny teeth, which is by Dr. Ruhan Singh. Also, there's one more on periodontist. It's much beyond just scaling on 14th August. These are some of the upcoming webinars. This is our website, www.dentistchannel.online. You can go to this website. You can enroll yourself as the prime member. And also you can follow Dentist Channel Online on various social media platforms where you can get regular updates about the upcoming webinars and the workshops. You can follow us on Facebook, Twitter, Instagram, LinkedIn, YouTube, WhatsApp, and also on Telegram. So we can now start with the Q&A section, Doctor.
Yes.
So there's one question. So are there any factors we need to consider before using a scanner in any patient with comorbidities?
No, see, if you have a good mouth opening, okay, you can use intraoral scanners. There is no contraindication which is related to any medical comorbidities. Okay, in patients of OSMF, in patients with trismus, where mouth opening is very limited, you cannot use intraoral scanners because of accessibility. Yeah. That's it.
So are there any more questions, anyone, before we end the webinar? We'll just give a minute or two for everyone.
Yes, yes, sure.
So I think we can end the webinar now, Doctor. So thank you so very much for coming on board with the Dentist Channel Online and delivering a wonderful webinar today.
Thank you so much, Dr. Richa.
Yeah, it was very, very, very nice to have you here with us.
Same here.
So, and also I would like to thank all the attendees. I think so there's another question. Yeah.
Yes.
So are these scanners delicate to handle?
Yes, definitely. Like you cannot afford to, drop it.
drop it.
Yes, yeah,
Correct.
definitely. You have to use it
And
with.
and they also come with a huge cost as well.
Yes, yes, definitely.
Yeah. So I think that's it. Are there any more questions, anyone, before we end the webinar?
I guess I can share my email address if anyone has any
Yeah,
queries later on. They can definitely reach out to me, guys. It is HILERIMORI 1995.hm@gmail.com, or you can reach out to me on my Instagram as well @dentowoman. Okay.
I have mentioned all the details in the chat box. You guys can have a look at it. The
Yes.
email is mentioned there. Also, her Instagram handle is mentioned there. So for any queries related to dentistry or anything related to prosto or anything, for any other help also, ma'am is there
We
with
have
you.
to help.
Yeah. So I think so that was it. So thank you so very much, ma'am, for coming here on
Thank
this
you. Thank you
platform.
so
And
much.
also thanks a lot to all the attendees. And I would request you all to become a Prime member with us so that you can get the e-certificate for this webinar and also for the other webinars you're going to attend in the future. So have a very good day, ma'am. Thank you so much for coming.
Thank you. Thank you. Bye-bye.